back to Guts and Girl Bits. Now, I know most of you listening are women, but today's episode is one that you're going to want to tune into and maybe even share with the men in your life. Because when we talk about fertility, we so often focus on the female side of things, our cycles, our hormones, our eggs, and we forget that sperm health plays a huge role, not just in the ability to conceive, but also in the health of pregnancy and even the long-term health of the child. Sperm health has been linked to pregnancy outcomes like miscarriage and preeclampsia. And what's fascinating is that while women are born with all of their eggs that were actually influenced by our grandmother's health, men are constantly making new sperm every few months. So that means that there's a much faster impact on our offspring based on what is influencing the genetic expression of the sperm. So lifestyle, nutrition, and environmental factors can all have profound impacts on sperm quality, which in turn shapes not only fertility outcomes, but potentially even the health and the development of our future generations. So now, that doesn't necessarily mean that we're talking about like evolving mutant powers anytime soon, but we are talking about how the choices that men make today can influence things like neurological, mental, and immunological impacts of our future generation and our future children. So to dive into this fascinating and often overlooked topic, I'm joined by Raul Pastrana. Raul is a degree qualified naturopath specialising in fertility and reproductive health. He focuses on helping individuals and couples optimise their fertility with a particular emphasis on male reproductive health, which is a factor that's often underestimated when it comes to conception outcomes. Raul works closely with patients through IVF, preconception care, and natural conception. He creates tailored plans based on each person's unique presentation and goals, and importantly, their blood pathology and semen analysis results. He's also the author of The Sperm Factor, Fertility, a Shared Responsibility, where he explores how men can influence fertility outcomes and provide practical strategies to improve sperm health. So in our conversation today, we talk about why it's so important to look at sperm health early in the fertility journey, some of the key factors that influence sperm quality, and why what's considered normal on a semen analysis might not actually be optimal. Raul also shares some really actionable tips on how men can start to improve their sperm health today. So whether you're on your own fertility journey, whether you're supporting a partner, or you're just curious about how male reproductive health fits into the bigger fertility picture and evolution, this episode is full of insights that might just change the way that you think about conception and reproductive health and wellness. So let's get into it. Thank you so much for joining me today.
Hi, Alison. Thank you for having me. It's a pleasure.
I'm so excited. We haven't done an episode for Guts and Bits in a long time. And I find it's kind of interesting that the one that we do to come back is actually about a bit more to do with men's health.
Yeah, it's great to talk about this topic that sometimes is underestimated.
That's right. And I mean, it is something that is going to be very interesting for our female audience as well, because a lot of the time, women who are going through issues with fertility, subfertility, sperm is something that they know is an important factor that they need to look at even before something has been identified, but they don't really know how to go about it or what are the things that has an impact, because there is so much information out there. But now we've got you on the podcast, we can really shine some light on what is the actual relevant information that people can action. How can we do things about it? So I'm really excited to get into this.
Yeah, me too. Let's get into the nitty-gritty.
So you've been in practice for a few years now, and what is the thing that led you into working with sperm health and fertility so much?
Since I finished my naturopathy degree, I have been exposed to a large number of fertility cases. And when what came very relevant and undeniable is that when a couple is trying to conceive, usually the weight of responsibility is placed on the women, on the female factor. So she is the one that usually makes the appointment, has the scans, has had multiple blood tests, is already taking a few supplements because she has done some investigations to what can she do in order to improve her outcomes. But in many cases, the male factor is underassessed, undertreated, and also under research. And this is really puzzling as a practitioner because the research is telling us that this is wrong. 50% of all fertility cases are related with the male factor. So there is, at least from all the infertility issues out there, 50% of them, there will be some male factor contribution. And this is why if a couple is having trouble conceiving, both sides of the equation need to be investigated at the same time in order to have the best fertility potential and the best outcome.
That is
So
crazy, 50%. And it doesn't really reflect, does it, with the way that the investigations get done? It's usually always, all right, well, let's look at the woman first. Instead, it should be both at the same time.
absolutely both at the same time. So the male should be getting a semen analysis. And in that semen analysis, that is just the most basic start. We need to assess the most common findings, which maybe your listeners are already familiar with, which are the semen quantity, or how much sperm is there in terms of concentration.
Mm-hmm.
But also, how is that sperm moving, that motility? And last, how is the shape or the morphology of that sperm? These are usually the three factors that they are first assessed when the male factor is assessed at all, if so. And that's where everyone should start with.
With the sperm analysis and those
Yeah.
markers.
Yes, that's the baseline. The one thing that I will say it gets overlooked more often is the DNA fragmentation as well.
Mm-hmm.
So the DNA fragmentation, it's a test that can be done in the sperm to understand what percentage or how damaged is the genetic material inside of the head of the sperm. So if the genetic material inside of the head of the sperm is fragmented, that's going to have repercussions for conception, fertilization, pregnancy outcomes, and the future health of the baby. The DNA fragmentation, think about it as if the DNA is broken, the instructions to make the baby and the instructions for fertility outcomes, they're not going to be as good as we want them to be.
Mm-hmm.
So we want to make sure that we are addressing all the factors that are affecting male fertility to make sure that the copies of the DNA inside of the head of the sperm are intact as possible.
That's right. And have you seen that it's often something where you get a sperm analysis, there's already been done, but DNA fragmentation isn't included?
Yes, that's exactly what happens very often. So we get the sperm morphology, the motility, and the quantity, but then the DNA fragmentation is not done. And the thing is, it's just much more easy to get it done all together on the first analysis. So then there is not need to pay again to get again to the clinic. So it's better if you haven't done one yet and fertility is a concern. I always recommend to include DNA fragmentation inside of the panel.
That's right. And it's an additional cost, isn't it? Whereas a sperm analysis can be covered under Medicare if there is issues with fertility over a certain amount of time, whereas the DNA fragmentation is usually paid by the patient, isn't it?
Yeah, that's correct. And something that's a factor that can be a barrier for some people. I completely acknowledge that finances can be a barrier. But when you think about the cost of some of these very expensive and very invasive artificial reproductive technique interventions, paying $100 to understand the quality of the DNA in that sperm, it is, in the scale of things, is not that much.
Yeah, and I think it's definitely worth it to do it, but people need to know that they do need to ask for it because
Yeah.
it's not going to always be done automatically.
Yeah, and understand what it is that you're actually measuring, like how intact or how damaged is that genetic material. It is very important to understand that.
So when people are looking at the sperm analysis, so the things that you look at is the morphology. So how normal does the sperm look? Does it have a normal shaped, teardrop shaped head? Can it actually penetrate the egg? Or does it have a big lollipop head or a little pin head? Because all of those things need to work to actually do its job of conception. And does it swim correctly and swim fast enough?
Yeah. So that would be the swim will be motility, but the type of motility that we're looking for is progressive motility
Mhm.
because it's not just about the sperm be able to move, but move in a straight direction. So the sperm can meet the egg usually in the fallopian tube, and then there can be fertilization of the egg.
That's right. It's not going to get where it needs to go if it's swimming in circles or sideways.
Correct.
Yeah.
And another factor that I would say regarding now that you mentioned the morphology, the motility, it's very important to understand what we are comparing, what are the reference ranges that are on the right-hand side of the piece of paper that we get with any semen analysis.
Mm.
So how are those reference ranges established and what do they really represent? Because that doesn't mean the fact that a sperm analysis fall within a normal reference range doesn't actually mean that the sperm is optimal or healthy, unfortunately.
That's right. And
So
that was actually something I was going to ask you about as well, is how much has our reference ranges for sperm analysis changed over the years? Because I've seen it, but you would have the data on that.
yeah, so only sperm concentration has dropped dramatically is dropping dramatically every year. And sperm quality and concentration has been dropping since the 80s. But from data that we have from very, very extensive research, we know that the drop is even bigger since the year 2000. So sperm is not only declining in quality, it's also declining faster than it used to be since the year 2000.
Mm.
Um, and because the average male sperm has such a poor low quality, then when we are creating those reference ranges, we're comparing ourselves with a sample that is not very good in quality anyway. So I don't know if you know how those reference ranges were established, but in the year 2010, the World Health Organization did a study with over 1,400 men from 14 different countries. And all of those men were able to conceive with a female partner in less than a year. And then they analyzed the data from sperm concentration, sperm morphology, and sperm motility for those 1,400 men, and then divided from the lowest quality to the highest quality. And they divided in percentiles. And they established that the fifth percentile was the normal range, and that's what was established as normal reference range.
The fifth
So
percentile.
the fifth percentile, so the lowest score possible. So were they able to conceive? Yes, but was that actually normal? Not really. Normal will be the medium, and the medium should
Yeah.
be the 50 percentile, not the fifth percentile.
That's right. And there's a big difference between that. I mean, sperm concentration at the 50th percentile is 73
Yep,
million
yep.
per mil. And what's the reference range?
15 million only.
That's very big jump.
Yeah, 15 million per meal. So it's a huge jam. And this is why it's important to understand what are you comparing
Hmm.
your sperm or your partner's sperm to. Are you trying to just pass the test, or are you really trying to assess whether or not this sperm is good quality?
Mm-hmm.
And if you're trying to assess that, it's better to compare it with the 50th percentile.
Yeah.
So, for example, for sperm concentration, instead of 15 million, 1.5, you want to get closer to 73 million, like you
Yeah.
just said.
Yeah.
For sperm motility, instead of 40% of the sperm being able to have motility, you want 61% of the sperm to be able to move well. And for morphology, is the same. Only 4% is enough to pass. You only need a 4% of your sperm to have optimal morphology in order to pass the test. And don't get me wrong, you don't need this parameter of morphology doesn't need to be close to the 100% whatsoever. It is very normal to have a morphology on the 10%, even 9% is enough to have a good fertility potential, but the 50 percentile will be 15%. So you see the huge disparity that is between what is considered normal or what the reference ranges were established and what actually health and good fertility potential represents.
And I think what we're seeing is that men get told you're fine, you're in the reference ranges, but we do want to aim for a little bit better. We want super sperm. But I was thinking, and when I was researching for this, I actually realized that humans are the only species that have such a low average morphology. Compared, like animals, their morphology is pretty much always like 99% normal. Whereas here we are as humans. And do you have any ideas on what that might be?
Well, the reason that our morphology, like any other of our parameters, has been declining, it's a number of different contributors. Every day we live in a society that we are more overstimulated. There are endocrine disrupting chemicals. We are sleeping less than ever before. Our nutrition as an overall society and the quality of our diets is declining. The quality of our food supply, it's poorer than ever before with more, like I said, endocrine disrupting chemicals in the food supply. So all this is having an effect not only in morphology, but in all the other parameters. And look, what I always say to my patients or to anyone that is thinking about improving their sperm health, you won't improve your particular circumstances if you don't identify the barriers. And those barriers will be different from you than from someone else. Even though there are some commonalities, it's important to do a thorough investigation to see why your sperm health has been affected. And things won't get better because you take a very fancy supplement from the internet. That's just not how it works.
No, you have to do the work.
You have to do the work, and supplementation sometimes works. So if we have identified in your blood work and in your sperm analysis that there are specific factors that can be resolved by a specific supplement, then the intervention can be put in place. But taking just a random supplement with really good marketing behind it is not going to solve the issue.
Because sperm is when it's in the testes, it's very protected. But when it gets into the epididymis, it's much more exposed to chemicals and toxins and lifestyle issues. So that's one of the major things that causes the damage at that point, isn't it?
I will say that a sperm synthesis or a spermatogenesis, which is the same thing, is actually a very delicate process at all stages. If we think from an evolutionary perspective, if there is danger, there is lack of resources in terms of nutrition, vitamin, minerals, the first thing that is going to go is a sperm synthesis. And that's because it's not required to keep the system alive. So that's why if there is high level of stress, if there is chemicals, a sperm synthesis is the first thing that can go. And it's this sperm synthesis or spermatogenesis, it's something that takes around 72 to 74 days to fully develop.
Yes.
And I think this is a really important takeaway from anyone listening, because your sperm results can be highly influenced by you making the right things. So if alcohol intake is the problem, if stress is the problem, if sleep is the issue, and you resolve and address that factor, you can see results in your sperm quality and quantity in only 3 months because of that constant and dynamic process that is happening at the testicular area. So renewing those sperm cells every 72 to 74 days. And just a note about what you said. So yeah, it's a very delicate process that can be affected and influenced in many different ways. But from those 72 days, like you mentioned very correctly, the last 15 days when the sperm is going through the final tract in the reproductive male system is highly and easily damaged. So it's at that stage where we want to be extra careful. What are we putting in our bodies? Alcohol intake, stress, etc. So what I do with my patients, especially for those that they're going to freeze their sperm and their sperm is going to be used for C procedures or IVF procedures, I give them a high level of antioxidants such as vitamin C, CoQ10, lipoic acids, nicotinamide riboside, and many others. So we protect that testicular environment and that sperm going through the last 15 days before ejaculation. So the DNA is intact, the morphology and the motility is as good as we can.
Yeah. I think that's a really good point because the sperm are so sensitive to oxidative stress. And so what you're describing is loading them up with lots of antioxidants to give them that protection that they need. I wanted to share something that I found really fascinating when I was researching this is that when they are in that epididymis, which is basically like a big like collecting duct after they've gone through the testes, it's like a training center that they go through where they learn to swim really well and their immune system changes. And I saw some stuff where they said they took the sperm from the testes before they got to that point, and then they inseminated a woman with it, and the immune system killed it straight away. Whereas after it had been through the epididymis, it didn't. But we can talk about that immune onslaught of the sperm later because that's also really interesting. But they learn to swim, their immune system develops, and they learn to smell. How amazing! I found that was just like so fascinating. And that
Mhm.
they learn to detect the smell of follicular fluid, and just like a shark, they can find 1 part per billion follicular fluid and just zone in on it. And that's how they know how to go. And I was just like, I had no idea beforehand that sperm could smell.
Yeah, science is still trying to understand how is that even possible? How is possible that the smallest cell in the human body can have such a complex function? How is it possible that can be attracted by something that the egg is releasing? So it's believed that the egg is releasing certain chemicals that, like you said, they are in such a low quantity, but the sperm can sort of smell them, be attracted to it. So it's really fascinating. And like you said, that training and that capacity to have that sense is highly influenced for what's happening in the last 15 days before the sperm is ejaculated. So like you said, it's like a training center. It's like the sperm are going through the gym in those last 15 days.
Yeah, all right, boys, you're being grown. Now you got to know what to do. Yeah, I know the work of Leah Hechtman, she's often spoken about how conception is a microbial event and that the sperm and the oocyte, the bacteria of each thing needs to agree, and they need to like each other. And that is where a lot of that olfactory sense comes in as well, which is so super interesting too, because of how we know that, like, for instance, the microbiome of the oral health and the gastrointestinal health, that all influences reproductive health as well.
Yeah. So in many cases, when some of these factors come as clear and there is still a question mark to what could be influencing male fertility or female fertility, we can do a seminal microbiome, but we can also do a vaginal microbiome. And
Mhm.
that can give us some insight into if there are any immune factors that could be negatively influencing fertility potentials. And there is still so much data coming out. There is a lot of science and a lot of money that needs to be still put on so we get better and more quality studies regarding this. But it is clear that, for example, from the vaginal microbiome of the female, in order to have a good fertility potential, needs to be lactobacillus dominant.
Mhm.
So we know that much. And that will have a huge influence to whether or not the sperm can actually fertilize.
Can you speak a little to how when the sperm is ejaculated into the woman, like what stages it goes through, how fast it travels, and like the way that it sort of gets culled down along the way to the sperm, to the oocyte?
Yeah, so the sperm, if natural conception is how it's happening, a sperm gets ejaculated and it starts traveling. And like we said, that motility needs to be happening. If there is not progressive motility, which is swimming on a straight line, it's not going to reach the egg. So the egg is released obviously from the ovary and travels to the fallopian tube. The sperm is ejaculated and it starts swimming. The process of swimming usually takes around 2 days in order for the sperm to reach the egg. And that's when usually fertilization of the sperm in the egg happens in the fallopian tube. If everything is going well, then that embryo already created starts traveling slowly towards the uterus. And in that process of traveling, which can last around 5 to 6 days, the embryo starts developing and subdividing and going through a process of cell division into something called blastocyst. It is the blastocyst then that arrives to the endometrium, and if everything is going well and there is good endometrial lining, there is good endometrial receptivity, and there is also good endometrial microbiome. Again, the immune system having an influence to whether or not that embryo will be able to attach itself to that endometrial lining and create a pregnancy, and hopefully a healthy pregnancy.
And on the way to get there, it has to sort of go through a bit of an immune onslaught, doesn't it, from the woman's immune system?
Yeah, exactly. So there has to be certain immune adaptation for all that to happen. And that's why if there is what I call low-grade chronic inflammation where the immune system is constantly active. And we hear about inflammation these days in the social media over and over. And inflammation is not neither good nor bad. We need good levels of inflammation if we cut ourselves or if we have a pathogen in our system. But when inflammation is not resolved, becomes chronic. And if there is chronic inflammation, that's going to activate chronically the immune system. Now, the process of pregnancy is highly sensitive to immunity. So we need to be able to lower our immune defenses in order for that embryo to attach to the endometrial lining. And if not, it's not going to happen. If there is constant hypersurveillance because of that low-grade chronic inflammation, the embryo will be rejected.
Yeah. So these are the things that like would potentially be shown up in the case of like a failure to conceive naturally. And then the woman would usually have to go and get some immune markers tested to see if that was the case. What about sperm antibodies? How common is that?
Look, it is common, but it's not that common.
Mm.
They are there, and it is also another factor that can be investigated, but I don't like to place a lot of emphasis on that into the general population because it's not something that has a huge representation when you're talking statistically. For example, DNA fragmentation statistically is just been shown how important it is to test. And I advise all my patients to get tested the DNA fragmentation on their first semen analysis. Sperm antibodies is, on the other hand, not my first line of assessment.
That's something you might invest in later if we don't get the information that you need earlier on.
Correct. If we're still having questions, okay, everything has come clear, why is pregnancy still not happening, then we can investigate that. What I would say with sperm antibodies is one of other little thing that will come in most semen analysis is something called agglutination. And that is how is the sperm behaving, whether they are all together in the sample or not. And if agglutination of the sperm is very high, then I always test semen antibodies, sperm antibodies.
Yeah, okay, interesting.
Yeah, so agglutination is something that if in the first semen analysis comes as high, then it is a prompt for me to test further, do more testing.
I was thinking when you mentioned that about how naturally like the nature of sperm in all species has to be quite sticky in order to sort of like to get there. And so the whole concept of like a woman having to lie down for a period of time after sex, like so women think that they have to lie down for like, half hour or an hour or something like that, whereas it's really not that long because of how sticky it is. But that comes from like way back evolutionary times when a bit like a praying mantis or a spider, like a man's got to get in and run.
Hmm. Hmm.
Um, and that obviously that's hopefully different now.
We have changed a little bit as a society since, but I think the main principles still apply.
Yeah. And I think actually I think that, you know, what we were talking about, how the sperm in animals is very different to humans.
Yep.
I think that's also got to do with a bit of an evolutionary trait as well, because of like the rising impact of varicocele and all of that. And it's all about like how we're upright creatures. And so the blood flow doesn't go back out very easily. And so then there's so much more blood there. And especially if people do have varicoceles, do have varicoceles, it's such a hot environment, which causes the damage, that oxidative stress.
Yeah. Yeah. Varicocele is actually very, very common.
Hmm.
And for everyone listening, what varicocele is like nothing else than a varicose veins, the same one that some people have in their legs. But instead of being in the legs, they are in in the scrotum. And what a varicocele is nothing else than a dysfunction of the cardiovascular system. So it's part of the cardiovascular system that is not working well. So if it's not working well, the blood that is arriving to the testicles to bring in nutrient rich and oxygen rich blood and removing waste products is not working well. The other thing that an optimal cardiovascular system is doing at the testicular area is making sure that there is no rise in scrotal temperature, like you just mentioned.
Mm.
So again, we were talking about evolution and why things are the way are. So females, they have their ovaries inside of their body, and that's because the process of egg production and egg maturation doesn't require different temperature than body temperature. For male fertility, the process of spermatogenesis requires around 2 degrees lower than total body temperature. So that's why the male gonads are hanging out,
Hmm.
right? Now, if for whatever reason that temperature rises, one of the things would be varicocele because there is not enough blood flow and blood flow is not optimized. But another thing is wearing tight underwear, being sitting for long periods of time, pushing the testicles towards the body, going to saunas. All those factors are going to negatively
Mm.
influence the quality and the quantity of the sperm. And what you were saying about, the cardiovascular, the system and the varicocele, if we think about it, what is the number one cause mortality for men worldwide? It's actually poor cardiovascular health and cardiovascular events. I mean, unless that it has changed recently. If it's not, the number one is at the top there. So one dysfunction that happens from having issues with the cardiovascular system is having varicocele, which again has a huge influence in sperm health. And the way to assess whether or not someone has varicocele ultimately is with an ultrasound of the testicular area.
Some highly trained physicians can even palpate it.
Yeah, they can palpate it, and some even are visible just with visual inspection. But ultimately, for a proper diagnosis, at least in Australia, what the guideline said is that ultrasound is needed.
Yes. And it's usually surgery is the treatment, isn't it?
Yeah, so it really depends from person to person. Not every single male patient with varicocele and who is experiencing fertility challenge will be offered surgery. It really depends on the person because the recovery time, and I'm talking about the time that the sperm will need to recover in terms of quality and quantity, it can take from 6 months to a year.
Hmm.
And this is based on research. And unfortunately, some couples don't have that time on their hands. And then instead of surgically removing the varicocele, other options are offered, like IVF or other artificial reproductive techniques.
Hmm. Okay. So while we're on that topic of things that can go wrong, let's talk about some of the other factors that may be an issue in terms of affecting sperm health.
Mm-hmm. Yeah. Do you have one in mind, or do you want me to tell
I'd
you
love for
what are
you
the
to
big
just go
ones?
for it.
Look, there are so many factors affecting sperm health these days. I always like to let the patient, when I have a patient in front of me, I like to allow the patient to expand on their health. Tell me your clinical history. Have you had any major health events? Do you have any diagnosed medical condition? Because that's obviously going to have a huge effect on your sperm health. So that's how I start a consultation, letting the person speak. And if they haven't talked about this, then I always chat about what I consider the pillars of health. So that will be, how is your nutrition? How is your sleep? How is your stress management? And are you exercising at all? If those are not addressed, usually I start from there.
Mhm.
Improving their diet, improving their sleep, their stress management, which goes hand in hand with the sleep. And then I always encourage someone to start exercising if they're not exercising at all, little by little. So that will be the way that I think about a consult. But above and beyond the four pillars of health, there are so many other things affecting sperm quality. One of the things that I speak a lot in the book that is coming out, the male factor and why fertility should be a shared responsibility, is about the role that pharmaceuticals play in male fertility. For example, the use of antidepressants has been linked with poor semen analysis. I remember this particular case for a patient that I had a couple of years ago. This male patient was taking 150 milligrams of a particular SSRI. And then we analyze many of the other factors that could be influencing him, his diet, his sleep, whether or not he had nutritional deficiencies, whether or not he had low testosterone, which obviously also influences sperm health. And everything came as normal. Nothing else than the antidepressant was an alarm bell. So I obviously gave this person high level of antioxidants. I gave him a multivitamin and omega-3 to make sure that we were protecting that testicular environment and giving as much of the nutrients that the body needs to create the sperm. But then the one thing that I work with, as well as in conjunction with his doctor, is to slowly reduce the dosage of the SSRI. And this is a case-to-case scenario. Some people, unfortunately, they cannot reduce the dosage of their antidepressants because they really need it. But in this particular case, the patient was open to try. And we worked together, making sure that his neurotransmitters were repleted, that everything was working as well as possible for him. And he went from 150 milligrams to only 25 milligrams in the course of 6 months.
It's a massive drop.
It is a huge drop, but I have to say, this person also at the same time start exercising, improve his nutrition. Oh, there were lots of things that he was not doing before that then he did, and I think that also allowed him to drop the antidepressants. We retest his sperm. I I can't remember the exact number, but I think his concentration went from like something like 9 million to 39 million, something like that.
Mm.
And look, I think exercise plays here a huge role, and we will never know what was the percent of the influence on each of the factors, but SSRIs is a good example of how specific pharmaceuticals can have a huge effect on sperm health.
Mm. And I do think that it's a very big issue overall because most medications are studied on their effect on fertility. And when you do see a lot of these medications being used in younger and younger generations, like blood pressure medications or antidepressants, which maybe they were originally put onto the market thinking people would be past their fertility years at this point, so we don't need to study sperm in that case, or female reproductive, because God, heaven forbid anyone study that. It's like, it's one of these things that it's just an unknown, and it often doesn't get thought of at all until much later, or it takes someone that's a little bit more savvy to go, maybe it's the medications causing the issue.
Yeah, yeah. And there is definitely more research that needs to be conducted into all these factors, and some certain medications, we don't know whether or not they're having a huge effect. I'll give you another really good example. So finasteride, or the drug that it's been highly used these days for male patients to prevent hair loss. And what this drug does is basically prevents the conversion of testosterone to its more potent form, DHT. So this medication prevents that conversion, and therefore, because that doesn't happen in the body, hair loss is prevented. So these days, there are lots of 20-year-olds, 30-year-olds taking this medication. And um, I have seen some preliminary studies that point towards how this medication is negatively affecting sperm health. Clinically, I have seen a few cases of it where stopping the medication and doing a bit of work with the male patient and retesting 3 to 6 months later lead to great improvements in sperm analysis. So um, this is another factor, right? This drug was not designed with the idea in mind that could affect male fertility, but it is indicating that it does. So if a couple is having trouble to conceiving, I think it's important to review all the medication that the two parts are taking, the female part and the male part.
Another big one would be anabolic steroids, wouldn't it?
Yeah. And I talk a lot about this in the book because I'm seeing more and more and more of it. It is very common. It is very common amongst gym users these days. I think, look, we could get into the rabbit hole of why is this happening in the first place, which will be social media putting body image, placing at unattainable body. Yeah, so social media these days, what I think it's doing to our young population is very clear. It's affecting their mental health, right? And then you have all these social media influencers telling them, you can get the body that I have, you just have to follow this diet. And they're not telling them the whole picture. In many cases, not all of them, but in many cases, they might be using anabolic steroids, and then this is filtering into the younger population. Every day, more and more, I see the effect that anabolic steroids has in the medium and in the long term of sperm health. So even if the person had used anabolic steroids a year ago or 2 years ago and they are trying to conceive, the long-term effect that anabolic steroid had is still visible.
And I think that obviously there's much more detail in your book, but the anabolic steroids do have much more longer consequences. Whereas some other medications, you may be able to like reduce the dose or take them off of it, and it can be reversible. Whereas anabolic steroids really does shut down a lot of the communication that causes the sperm development.
Yes, it can. So definitely the long-term consequences can be huge, but not for everyone. It is a case to case.
It would depend on how long you've been taking it for as well.
Yeah, and also very important how well you recover, which will have a huge factor will be how old you are. So when you're taking it, just to give an example, when you're taking testosterone, what you're doing is having an influence on the negative feedback loop that happens in between your brain and your testicles. What you're really doing is telling your brain you can shut down the communication between the brain and the testicles. You don't need to stimulate, the brain doesn't need to longer stimulate the testicles for
Yes,
more.
like say we've got enough, we've got heaps, don't worry.
Yeah, we have hips. So then endogenous, or the production of testosterone that happens in the testicles, stops, but also sperm synthesis diminish highly. And then, like you said, how long do you take the anabolic steroids for? And what dosage did you take? And how old were you when you were having this? All this will have an influence to how fast you recover, if you recover.
So we're going to probably wrap up now. So I thought that it would be great to share some tips that you have for people, just general things that you would say to people who are wanting to improve their sperm health, if that's okay.
Yeah, sure. Well, the first thing that I would say is get the book because it's fantastic. But look, seriously, for anyone that is trying to improve their sperm health, first of all, what are you comparing your sperm to? Like we already said, don't go for the bare minimum. Try to do as much as possible because I'm sure that your female counterpart is also trying to do as much as she can. So let's share the way of responsibility when it comes to fertility. Let's go to those appointments. Let's make sure that if we have been prescribed a supplement, we take that supplement. That if we've been told that we need to stop alcohol, which we haven't spoken about, but obviously it's huge, we stop alcohol altogether. Or maybe you reduce from having 7 drinks per week to just having 1 to 2 these drinks per week with your friends. But do your contribution. That's what I will say.
That's so
Tackle,
important.
yes,
I don't think it's widely known how much sperm has an impact on pregnancy rates, pregnancy loss, and as we said before, the health of the child.
the health of the child. Yeah. Don't think that, for example, because your partner is able to get pregnant but she's miscarrying, the issue is lies within her. And this is not about shaming, but about education. Sperm health can lead to early miscarriage. Let's do our part into supporting our counterparts, our partners, as much as we can and share the weight of responsibility. And you were asking me, what are the main things that someone can do? Let's tackle the big ones, right? Like the obvious ones. So alcohol, huge. Like, I mean, there is so much research. And do we need more research? I mean, we always do need more research, but it's very clear the toxic effect that alcohol has in sperm. So it's just stopping alcohol is going to have a huge effect in improving your fertility outcomes. Making sure that you're sleeping well and that you're prioritizing rest. It's really, really, really huge. Eating well, making sure that you're getting your protein, your fiber, that you're eating a food that agrees with you. Those are huge factors. And then what I will say as well, if you are not working with a health professional and you are unsure what the factors will be, that's when you need to ask for help. And I think females are much better than males are asking for help.
Mm.
There is nothing wrong with saying, okay, I don't know what to do. Who can help me to improve my outcomes? I think that is an important factor to acknowledge when Google Doctor is not enough and when you need to look for a health practitioner that can guide you in the right direction. That will be my main takeout.
Okay. So yeah, actually ask for help and make the changes and accept the responsibility.
100%. Accept the responsibility shared.
Yeah,
Be
share your load.
yeah, be an active participant in the process because it just helps so much with the outcomes. And when I'm seeing a patient, and when I'm seeing a couple in clinic, and both parts are involved, and both parts are engaged, and they want to make the changes, I can tell you, the success rate was always much higher.
Definitely. I see that too. And there's also a lot of chemicals that are in our environment that, especially for certain workplaces, that I think that a lot of people need to be aware of as well. So like all the like smelly fuels and like benzenes and those sorts of things, those have a big impact too, don't they?
Yeah, and there are so many in our society. I mean, our food supply, the big ones of not eating food from plastic containers, making sure
Mm.
that you have a million steel water bottle. So all those things is something that I try to bring into the conversation. Maybe it's not in the first consult, but it's in the second consult, or I give them some handouts for them to read or websites that they can visit to understand if they're the things that they're using at home to clean the house could have a negative effect. So I like to give all those resources, which are very important. Another big one is where are you working? Where are you spending most of your time? If it's in a paint factory, for example, then we know that that can definitely be one of the reasons for low or poor quality sperm.
So there's so many things that can be addressed at that initial point with diet, lifestyle, as you said, the pillars of health, chemical avoidance, and assessing medications. And then beyond there, we'd have to consider the things that are genetic or structural, like the varicocele, which you mentioned, or conditions like Klinefelter syndrome, or people who are structurally missing a Van Steffens, or other like undescended testes and those aspects.
Mhm.
So beyond, when we get to that point, that's when, you know, we have the referral network, and usually at that point we'd be seeing very big things in the sperm analysis, like 0 sperm. So that's a big red flag to refer on for that. So people don't usually have to worry about that. If they have already got the sperm analysis, they can sort of go, okay, it's probably not too bad.
Absolutely.
But so beyond that, I think that there's so much to talk about, but obviously we have a lot of content that like you'll be able to share within your book. And that's a really great thing too, because I do know that, as we've spoken about, it's challenging for a lot of men to actually get to the appointments and to want to talk about it. So if they have something that's in front of them that they can sort of sit down and privately assess, that'll be really good. So I'll pop some links in the show notes in the description to help people find all of this as well. But can you just share your links?
Yeah, so if for anyone wanted to find me on Instagram, my name in Instagram is Raul Pastrana _hormonal health. At the moment, I'm working as a part of the team in RH Reproductive Health, which is a clinic with naturopaths and exercise physiologists that have a big bulk of the clients of the patients that we see are fertility based, but also in conditions such as polycystic ovarian syndrome, endometriosis, PMDD, and PMS. So all those important conditions regarding the reproductive system, and obviously male fertility. So that's what I'm working at the moment. So the website is rhreproductivehealth.com. For anyone interested to contact me, they can do it through the website, and I will be always happy to answer.
Lovely. Thank you so much for all of your wealth of information for today.
That's my pleasure. Thank you so much for having me, and looking forward to talk more.
Okay. See you. Bye.
Bye.
Thanks for listening to Guts and Girl Bits. As usual, here is the disclaimer. Please remember that all information is general and not a specific recommendation that replaces consulting with a practitioner. Please talk to your healthcare practitioner before undertaking any changes to your treatment regime. If you enjoyed listening to this episode, I'd really appreciate you sharing this with your friends. And what is really helpful is leaving a 5-star review, or if you're watching on YouTube, liking and subscribing. You can find me at www.naturopathnSW.com.au. Thanks for listening. Until next time.